Or where do we use these exosomes exactly? Like a person comes and asks, PRP or exosome, which one do you prefer?
I will
sir?
definitely prefer exosome.
Hi sir.
Hello.
So yeah, I wanted to know a little bit about exosomes because everyone in internet and Instagram everywhere we are seeing these exosome treatments and new
Correct.
clinics and all. So what is exosome exactly?
See, basically, yes, it's something new in cosmetic dermatology. Exosomes are simply, if you consider, they are vesicle bound membranous particles, and which has got a cascade of lot of signaling elements. I mean, peptides, DNA, RNA, which has got a good implication on regenerative medications. So now a lot of companies are coming up with exosomes, and in aesthetic dermatology, it is becoming a hot topic nowadays. And it's being sourced from different things, like for example, from animal sources, from human sources, from plant sources. So this is something very common and something new in regenerative medicine, the exosomes.
Okay, so what are the uses or where do we use these exosomes exactly?
So basically, exosomes are being used for regenerative medicine. We all know that gone are the days now. In the science is going towards regenerative medicine. How we can, even for that matter, to revert certain kind of, for example, some cancers, genetic disorders. But in cosmetic dermatology, exosomes have got implications on giving you anti-aging. So it is being used for anti-aging, giving you more of a youthful look on your face. It has got uses for hair fall nowadays, even for like PRP has become more or less obsolete now. Now exosomes is in a trend where they do more or less same way, but it's more considered giving a better results. So yes, this is used in cosmetic dermatology, in trichology. For hair fall, we use it. All the grades of hair fall, for AGA, telogen effluent, even for alopecia areata. So we use exosomes for face, for regeneration, for rejuvenating the face, for anti-aging. We use exosomes.
Okay. So if like a person comes and asks, PRP or exosome, which one do you prefer?
I will
sir?
definitely prefer exosomes.
Okay,
Yes.
so exosomes are much more better than
Better, absolutely.
Okay.
Because the only thing it should be it's very important that where from it has been sourced and how it has been made, and I mean there's a process. So we have some very good brands, but they are expensive. But we should always consider some good brands because it's something new, and even the science behind the exosomes is quite still in a initial stage. So sourcing it from a good company where they have got their good R&D and so that's something very, very important.
Okay. So if we want to use exosomes for phase rejuvenation, how do we use it? How is it?
See, they basically come in some vials, 5 ml, 10 ml vials. So ideally good to use it with micro needling. So you can combine it with different procedures. You can use, for example, a fractional CO2 laser and then spread an exosome on top of it, which will create that micro channels, which will, it's really good way of doing it. Sometimes you can inject it just like a mesotherapy into the skin. And you can sometimes use a derma pen and spread it around the face. There are a lot of ways. So basically, the exosome is to be delivered into mesodermis. So different modalities that we have in dermatology, we can use those modalities and deliver it into the appropriate layers of the skin, and then it really helps to give you a very good anti-aging qualities it has got. Yes.
Okay, so is it done in just one session or do we need to repeat?
We need to repeat. There's not, there's no such protocol which has yet come because, as I said, it's just in the initial stages. So, but in our practice at DermaTrico, we use once a month. Some school of thoughts recommend once weekly, but being a little expensive than PRP or GFC or the peptides. So we recommend once a month. 4 sessions are to be done. Maybe then once in 6 months, we recommend for the patients for just the maintenance.
Okay. So when can a patient start, when can they start seeing the results from exosomes?
So exosomes is not like any neuromodulators, like you will get rid of the fine lines within 2-3 days. It takes time because it works on neocollagenization, collagen remodeling, I mean, increasing the number of fibroblasts, making them more active, so that they excrete all glycosaminoglycans into the skin. So that's a process which takes months time. So results are permanent, but results are good, and it takes little time to get some noticeable results.
Yes. So it's like slow and steady.
Yes.
Yeah. Okay.
Thank you.
Thank you.